I'd like to welcome you all to the ribbon cutting of our emergency room expansion. We have a few people that would like to make some comments and give some thanks, and so we're going to keep it moving. I'm going to turn it over to Tim McKibbett, our Senior Vice President, and oversees the emergency services. Tim?
Thank you, Greg. This really was a team effort, and I'd like to make some recognition and thank some people on behalf of the hospital and the whole system. First of all, to Greg and the board for their vision and their approval of the resources for us to make the project happen. And to Ann and Tom Finley and Dale Reeves and the foundation board, thank you for your tireless efforts to help raise funds for it. Congresswoman Tammy Baldwin, thank you for securing our funding, a significant part of our funding for the project. I appreciate it. The way we design projects at our hospital is a team approach, and it's really we let the users do it. If they're the people, the nurses, the staff, the registration, the doctors, they're the ones who design the program because it's their department. They are assisted, of course, though, by our architectural firm, PRA out of Milwaukee, and I'd like to recognize Dave Rasich, Mike Sherbo, Jeff Holzhauer, Russ Owens, thank you all for your efforts. Scott, thank you for your efforts. And then J.P. Cullen was our contractor on the job, and you did a fantastic job, Kevin. Thank you. Working in less than ideal conditions because this was a project that we had to keep the ER going. We couldn't just build it and move into it. So they did a great job, and when our nurses ran out and said, you have to stop, they did. So thank you for your efforts there. Of course, our hospital ER leadership team, Jeannie, Gowler, and Shelley, did a great job keeping the staff on course. And our hospital construction coordination team, Greg Gall, Doug Waite, another fantastic project. We turned it over, and you guys did a great job, on time, on budget, so thank you for your efforts. Our community relations staff for events like today, Connie and Sarah, great job. Our medical staff, they put up with coming down the specialists to our ER when it was under construction, and they did a great job working in less than ideal conditions. But the end result is fantastic. Of course, to our patients and to our community coming in over a 2-year process for the construction process. They came in temporary waiting rooms, and the patient satisfaction, again, a credit to the staff and all of you did a fantastic job. Patient satisfaction did not slip, and they did a great job, so thank you all for your efforts going through the project. There's one particular medical staff member that I'd like to thank, and really was his passion and commitment that got the project focused and on track and completed, and that's our medical director, Dr. Rick Barney. And it's because of his passion and commitment that where we're standing today and the efforts with his group from Southern Wisconsin Emergency Associates that the project is what it is. So a lot of our credit goes out to Dr. Rick Barney. And it really did get tested. We were done with the project last about June 22nd, and on July 4th we knew we'd have a busy weekend. We see normally about 100, we saw 140, upwards of, that's 40% more than we see on a regular basis. And the staff did a wonderful job. Thank you all, and I'd like to turn it over to Dr. Barney, and once again, thank you for your efforts, and talk a little bit about the benefits of the project.
I wanted to come up here and stand with my nurses. I feel more comfortable when I'm surrounded by my nurses. This is a day, obviously, that many of us have had in our minds for over a decade, really, and I'm so proud to stand here and see Beloit in the State Line area open a facility that is this nice, this technology advanced. We deserve it as citizens in Beloit. It's the emergency department. Hopefully, you never have to come here, but it's an important service and cornerstone of any community, and I think we can be awful proud of what we as a community have been able to put together here with this fantastic community hospital that we're so fortunate to have, and then add a facility of this nature is just truly phenomenal. Kudos to everybody that Tim just said, just thousands of hours of hard work, which has paid off. What I'd like to make clear today is it's just not the facility, not a brand new building that we built, which you're going to get to see and have us explain shortly, but we also looked at all the patient encounter procedures from when a patient first presents to the emergency department to when they leave, as far as ordering tests, getting people upstairs quicker. We looked at every single part of that process when a patient's in the ER to make it as efficient as possible. So we've increased efficiency. along with building this emergency department. And we have a lot of surge capacity now. Our emergency department in particular can be kind of mundane for a period of time, and in 1 hour, all hell can break loose. And that's the nature of emergency services, but it particularly occurs here frequently. And so we have an emergency department that we can flex up and flex down, which makes it comfortable, makes it more efficient, and it also makes it cost effective, which nowadays is really important. So when we don't need to have an area staffed or open, we can close it. But when we do need it, it's available. So that's key to the design of this department. We've added a lot of new technology that we're proud of. So that's something that as you walk through here, you really don't see. But hopefully the people that take you around, our tour guides, will point out some of the new technology that's available, which makes this a state-of-the-art emergency department, not only in design, but how it functions. We're getting another ultrasound machine, brand new ultrasound machine. All of our physicians in the emergency department are trained in emergency ultrasound, which allows us to give bedside diagnosis within minutes. Whether it's a gallbladder, an aortic disaster, we can use it for eye problems, all sorts of things. So we're adding to our ultrasound technology. We have a new state-of-the-art tube system, not only now from the clinic under the road all the way over here, but from all areas of the emergency department. So when we get specimens that are sent to lab, they can go immediately to the lab in the tube system and not hand-carried, and that takes several minutes off getting your results back, which makes it easier for us to get you out of here in a more timely fashion. We have a state-of-the-art radiology suite, first of its kind in the United States, all digital x-ray room, and then we also have a CT scanner just for emergency patients, which you'll be able to see, something that I felt very strongly about that we were able to get accomplished, so we can get imaging very rapidly. It's all digital, it's PACS, so we can share it amongst doctors at the clinic and anywhere in the healthcare system, and as soon as they take the x-ray, I can look at it, literally 10 seconds later. So there's no films, no delay. We also have monitored beds really in the entire department. So we have 27 rooms, all monitor capable. The monitors are state-of-the-art and can do end-tidal CO2, capnography. They can watch EKGs continuously for changes in heart attack patients. So they're very up-to-date monitor systems. And then we also have a CarePoint EMS system. You know that we're very proud of our emergency medical services here in Beloit. We have a very strong fire department system. Our paramedics are awesome. Our EMT intermediates and EMTs in surrounding areas are awesome. They're very professional, and one of the things now with our communication system is we can get 12 lead EKGs in the field to identify heart attack patients before they ever come to the ER. So if you're having an acute MI, we know before you get here. If you need a helicopter, it's already on the way. If you need Dr. Leo to do something, we've already called him. If you're going to need a thrombolytic drug, it's already mixed and ready to go. So these are some of the things that we've done to make the emergency department more efficient at the same time that we built this beautiful facility. My last thanks would be to my staff, not my staff, but the nurses and my fellow physicians for working through the construction. It really wasn't that bad. I think the design, the way that we did things with the leadership team, Tim's oversight, which was phenomenal, on it every day. I got to see him almost every day. I'm not sure if that's good or bad. I'm happy that you're here. Can't wait to show it off to you and let you walk around and see things. Please ask any of our staff any questions. We're just proud as heck to show this off to you today. And without further ado, two guys that put in a ton of time with the effort to raise community funds. So I'd like to introduce Dale Reeves and Tom Finley to have to say a few words.
You're first,
I was coming in this morning and the sun was shining. It was beautiful out there, and walking up here, I think it's actually the first time I've seen it without any construction vehicles around or anything else. Like, it's absolutely beautiful, and I thought, gosh, this is the last time I hope I see this coming. We were talking to Dr. Barney. It is. It's one of those things that, you know, not necessarily you want to see, but understand for a community, this is so vital to bringing new businesses into the community and things like that, that that the community really responded. And I want to thank all the individuals from private donors to corporations and businesses that helped us out, and to the foundations of the local community that also helped us. Their generosity was unbelievable. And when we were given the task to raise funds, when we walked out there, everybody recognized the fact that they wanted a state-of-the-art emergency room in this community. And so it really made our job a lot easier knowing that we had the support behind us and the community supported it also. So their generosity was unbelievable. And although I don't think anybody else is taking Tom or I's calls any longer.
They're all on vacation.
Yeah, they're all on vacations. Yeah, caller ID is not a good thing. But I want to thank everybody for coming today, and thanks again for your generosity. And we're extremely proud of this ER.
You know, when you get asked to head up a project like this, as far as for the fundraising, your first answer is no. You just, because you know it's a long commitment. It's been, what, about 3 years we've been kind of messing around with this, and you know, not necessarily the best of times, but I'll tell you what, the thing that really drove me into this project was the staff and Dr. Barney, quite honestly. I mean, if you spend 2 minutes with these people, you become enthused, which is really, really cool. And you know, to have people that are that dedicated in our city that really want to take care of us, it's all you can ask. It really is. And so it makes your job an awful lot easier when you know that you've got these people that you're just trying to do what you can to support them, and it's really awesome. It's awesome. And you know, from a money standpoint, they gave back. Over 2/3 of the staff from all of you folks, for everything you do every day. I know a lot of you personally, and I appreciate it. Thank you very much.